Depression and its treatment. What is depression? Most of the respondents will relate depression to one having fluctuations in mood, feeling sad, and having a loss of interest in activity. According to the World Health Organization, more than 264 million people of all ages suffer from depression globally, and in specific, according to the Queensland Brain Institute, 1 in 7 Australians will experience depression in their lifetime. It is important to understand the distinct differences between depression and sadness. Depression is more than just a low mood and is a far more complex and serious mental health disorder. This mental disorder is characterized as being persistently depressed for long periods of time, causing significant impairment in our daily life. Possible causes of depression include biological, psychological, social sources of distress, and even genetic factors. One aspect that is common with all these factors is that they cause fluctuations in brain chemistry. This leads us to the most accepted definition of depression. Depression is a neurotransmitter-orientated imbalance in the brain associated with neurobiological alteration. The signs and symptoms of depression vary significantly between individuals. Anyone can experience these symptoms from time to time, which is classified to be normal. However, a doctor will only diagnose a patient with depression when a certain cluster of symptoms arise and they are persistent for more than 2 weeks. There are common depression symptoms that most patients endure. These include feeling of hopelessness and helplessness, decrease in energy and feeling tiredness, irritability, change in appetite, loss of interest in activities and hobbies, difficulty with concentration, head and body aches, and thoughts of death and suicide. Neurons are the major types of cells in the nervous system which communicate through chemical messages known as neurotransmitters. These neurons communicate with each other over a tiny space known as a synapse. Each type of neurotransmitter carries a different message and plays a role in one's brain chemistry. So how does this all relate to depression? Well, depression is linked to the imbalances of neurotransmitters in the brain. Serotonin, norepinephrine, and dopamine are the main 3 neurotransmitters implicated in depression. Starting off with serotonin, or in simpler words, the feel-good chemical, serotonin acts as an inhibitory neurotransmitter that regulates sleep, anxiety, eating, sexual functions, and behavioral moods. In relation to the neurotransmitter serotonin and its role for depression, it has been scientifically suggested that a decrease in the production of serotonin levels leads to depression in some individuals. Going into the next neurotransmitter, norepinephrine is a vital neurotransmitter that acts as a stress hormone. It is released into the blood when the brain perceives that a stressful event has occurred and can affect the way the brain responds to these events. This is long established within the 1960s, where a famous theory known as the catecholaminé hypothesis explained that a deficiency in this specific neurotransmitter within the brain allowed individuals to have prolonged depressed mood. This is confirmed within recent autopsy studies that show patients who have encountered several episodes of depression have decreased levels of norepinephrine than people who have no depressive history. It is also evident in some individuals who have depression that their low-level serotonin further leads to a drop of norepinephrine levels. Finally, dopamine is a neurotransmitter that is also associated with depression. Dopamine plays a crucial role in controlling our drive to seek out rewards as well as our ability to obtain a sense of pleasure. Hence, low levels of dopamine may explain why some are depressed, as they don't get the same level of pleasure out of activities or people as expected. The treatments for depression are endless, yet may not be effective for everyone facing depression. The first-line approaches such as antidepressants, counseling, psychotherapy, or talk therapy do not necessarily treat all patients with depression. However, there is a recent and more advanced treatment option available known as the transcranial magnetic stimulation, or in other words, the TMS. TMS was developed in the 1980s by Anthony Baker, and since then, the FDA has approved the technique for treating adverse mental health symptoms. TMS is a non-invasive treatment that is utilized to stimulate the brain. Before having a TMS therapy session, a physical exam, lab test, as well as psychotic evaluation will take place to ensure that a patient is eligible for TMS therapy. Here is a short explanation from the Loyola Medicine at Paulus Health Campus on how the process of TMS takes place.
Do this with a patient and they're sitting there awake in the chair. The coil is an electric current, and that will result in a series of magnetic pulses. The magnetic pulses will actually stimulate the brain and actually cause neurons to fire.
Stimulating the brain gets those neurons more active, doing the jobs they're supposed to be doing, which emits some of those chemicals that you normally get from your medications, the serotonin, norepinephrine, dopamine.
Those neurons and the resultant firing of all the other neurons that get triggered off does result in an improvement in symptoms.
Therapy sessions for TMS typically occur 5 days per week for 4 to 6 weeks, and each session may last between 20 to 50 minutes. Relief will start to become prevalent in the 3rd to 6th week. Addition therapy session may be taken if the technician believes the patient needs further treatment depending on their signs and symptoms. Even though TMS is well tolerated, it does have some side effects. The most common side effects are headaches during or after the treatment, one feeling lightheaded, and scalp discomfort. A rare yet serious side effects are seizures and hearing loss if ear protection is not carried out appropriately. Overall, TMS is proven to be a safer measure to take on than drug therapy due to its reduced side effects and its effectiveness on patients with depression. Neurofeedback therapy is another effective procedure for the treatment of depression. This therapy procedure has been around since the 1950s and has been increasingly used in mental health clinics. Neurofeedback, or in other words EEG biofeedback, is a brain-based treatment that uses a sophisticated brain-computer interference to strengthen and renovate the brain by training brain waves, which are the tiny electrical signals produced by the brain. Research has shown that neurofeedback therapy has the ability to improve one's attention, emotional self-regulation, and executive control. Also, neurofeedback therapy is proven to be as effective as medication, with the bonus of long-lasting results and minimal side effects. This procedure takes place by first identifying the areas of concern within the brain and then painlessly attaching 1 or 2 leads to these specific areas on the head. These leads are connected to a computer software that measures brainwave activity. When the computer software detects that the brain is functioning efficiently, the patient is rewarded and the movie presentation they are watching instantly becomes louder and brighter. However, if the brain is not responding and is not doing well, then the movie presentation goes instantly darker and quieter. Training sessions last between 20 to 30 minutes, and typically patients go for a course of 20 sessions for 2 to 3 times a week. After the training procedure is done, the patient takes a break from the training session and is then reassessed later, and a decision is made if the patient needs further treatment. Neurofeedback therapy does not only change one's brain chemistry but also one's lifestyle. Therefore, both TMS and neurofeedback therapy are essential and effective therapy measures that support and benefit those with clinical depression.